We're continuing our coronavirus coverage with a discussion on how to manage fear and reduce panic. That's today on Nevada Week.
Support for Nevada Week is provided by Senator William H. Hernstat, Cashman Equipment, and additional supporting sponsors.
The COVID-19 outbreak has led to the World Health Organization declaring a pandemic. In its wake, we've witnessed state and federal governments issue states of emergency, widespread event and school closures, record stock market drops, and the first local furloughs and layoffs. Some of the panic is visible, like the food, toilet paper, and medical supply rushes we've seen in local supermarkets. Other panic might not be as noticeable due to social distancing. To discuss the latest effects of COVID-19 and how to reduce fear and panic, we are joined by Christina Madison, Associate Professor of Pharmacy Practice with Roseman University of Health Sciences, Stephen Benning, Director of the Psychophysiology of Emotion and Personality Lab at UNLV, and Mike Pequeen, Managing Director and Partner of Hightower Las Vegas. Well, thank you so much for being here. We really appreciate it. This is a very important discussion. And Stephen, I want to start with you. Uncertainty seems to be at the top of the factor list here when we're talking about this. We just don't know how bad, how long, how many. These questions are just unanswered. How are people managing this level of uncertainty?
The ways that people are managing the uncertainty that this anxiety is stoking is by trying to find a lot of news all at once, and many times they find themselves overwhelmed in trying to figure out who it is that they should trust, what kinds of information are relevant, because the situation changes from day to day. It's important that people have reputable sources that are close to the data at hand to get that information, but they should probably be checking those sources for maybe 5 to 10 minutes at most at the start of the day, and then maybe once or twice throughout the day to keep themselves informed, rather than setting themselves in front of the fire hose of information for hours on end.
Dr. Madison, the World Health Organization, when they announced that we had a global pandemic, also announced that we have an infodemic, and their definition of that is an overabundance of information, some accurate, some not, that makes it hard for people to find trustworthy sources and reliable guidance when they need it. When we're talking about the public health crisis that we're dealing with right now, how does infodemics affect that?
Yeah, so excellent question. And again, thank you so much for having me today. When we look at individuals' mental health, this tsunami of news that's coming out from a public health standpoint is really detrimental when we're getting conflicting information or when we're seeing misinformation spreading through social media. And when we see, young people going out saying, that they're gonna, that they're not afraid of the coronavirus and they're gonna continue to live their lives, it puts all of us at danger. So we really want to make sure that individuals are practicing that social distancing and really following the Centers for Disease Control's recommendations to not have social gatherings. I know it's making a huge financial impact, which I know you're going to discuss in more detail a little bit later on, but this is for the best measures that we have right now because we have no vaccine and we have no currently approved treatment. And so those who are most vulnerable, those with chronic medical conditions, the elderly, those individuals who are immunosuppressed, those are who we're trying to protect. And right now we're still learning about the virus. We're not sure how long it lives on surfaces. We don't know if the well people are spreading it. And so this is what we need to do to protect the health and wellness of everyone. It's a sacrifice, but it's necessary so that everyone comes out of this and we survive. Because if we don't, we're going to have more deaths. And that is definitely not what we want right now.
It's the long-term strategy, absolutely. Stephen, Dr. Madison's talking about social distancing. This is something that is new. This is a new term. We haven't really heard this before. And in so doing, this could potentially increase the amount of isolation we feel and could potentially then also direct us more towards always looking at that news, as you mentioned, is kind of the tendency here. Psychologically, what are we going through when we're dealing with some of these factors like social distancing?
And this is one reason why I prefer to call it social spacing, because when we think of social distancing, we think about distance not just from each other physically, but it entails emotional and psychological distance that we don't want to imply. Many times when people are engaged in this kind of physical distance from each other, it's hard to feel connected. And we know that interpersonal connections are really important for us as human beings. Some research from my lab shows that people really do physiologically feel better when their friend is touching them on the shoulder. And so what comes out of this kind of work is a sense that we need to find ways to stay connected with each other even if we can't be in physical proximity. Eliminating the emotional distance will help us cope with the social distance. And using technology in a variety of creative ways to keep that connection will very much help us do so. Video technology, chats, group texts, phone calls, other kinds of things, even messengers on social media, allow us to maintain that kind of connection, whether through voice, through text, through video, all kinds of methods, to let us know that we are still here for each other and we are still able to do things together.
Now, we've seen some minor levels of panic, maybe the supermarket rushing and the hoarding of food is probably the biggest example of that. Everything you're talking about, some of these major factors here, is that then leading to panic, or what exactly is causing something like the hoarding that we're seeing?
Some work that my graduate student E.J. Smith and I have been doing on physical risk-taking indicates that we as human beings in physically dangerous situations focus and guide our behavior by both the amount of risk that we perceive and the probability or the likelihood of seeing it. And when people see on the news or for themselves the grocery stores are empty because people are panicked and activating disaster preparedness scripts they might have in their heads, they too think, I must have all of this stuff in case the worst happens and I'm forced to stay here for months. And so what's happening is that the stores are starting to have to tell people, you may only have X amount of Y thing so that everyone has a chance to have it. In this situation, the kind of panic that people experience and the kind of anxiety they have about the unknown causes them to fear for the worst and act as if they must prepare for the worst. And this is one reason why having that information from trusted sources talking about expected durations of social spacing measures becomes really important for people to have an idea what they should calibrate.
And we're going to talk more about those specific strategies in a sec. Dr. Medicine, I want to come back to just this level of panic, looking specifically at the virus. You already touched upon this already, but what exactly, if we are in kind of more of a widespread panic here, how specifically is that impacting things like containment, things like treatment of the virus itself?
Yeah, so one of the things that we saw with people coming back from Europe is that they were all stuck in that airport. I don't know if you saw that picture, but it was like, from my perspective as a public health professional, it was like a nightmare because all those people were stuck in that, one area of the airport and were being asked to stay there for hours, and they were so close together. So at that point, the panic is actually making the situation worse, because now we have people who may not have the virus but are now being contained in the same space with someone who does. And it's like, if they didn't have it before, they're going to have it now. So that was like the worst possible scenario. And again, it was because we didn't plan appropriately for those people coming back and potentially having the virus or not having the virus. So social distancing, I know that term can be a little bit challenging, but it doesn't mean disengagement, right? So we want to make sure that people understand that this is in an abundance of caution, and it's to protect those who we know are most vulnerable. So public health-wise, we know that these measures work. We've seen it with other pandemics in the past, and really this is what we have to do to make sure that we're keeping the public safe.
And on a personal level too, my doctor always tells me, if you want to stave off a cold, stress and sleep are the two most important factors. If you're panicked or you have an anxiety, I'm assuming stress can raise and sleep can lessen. is that another reason why we want to make sure that we're trying to reduce our anxiety as much as possible for a public health perspective here?
Absolutely. So our overall health and wellness is going to help us, if we do become infected with the virus, to be able to have our immune systems be healthy and well and fight it off on our own. And so that is another way that we may not have to burden the healthcare system, because if we're, experiencing those more severe symptoms and having that shortness of breath in addition to cough and high fever, then we end up having to seek medical attention and potentially needing more acute care measures. And if we're already healthy and well and we're keeping ourselves in good shape, we won't have to use those measures, and those can really be used for the most vulnerable and those who really do need those services. So these are all things that we know, getting enough rest, making sure that we're exercising. I keep seeing all these videos now popping up about workouts at home, which is great. I just saw something the other day about Netflix coming out with a service now that you can actually stream videos with your friends at the same time, so that we are still engaging, so that we have that connection with others, because as human beings, we know we need that connection. But staying healthy and well is definitely something we need to make sure that we're doing.
And Dr. Madison, obviously we're not going to health centers and places to work out, but being outside, is there any risk at all if we are outside walking, hiking, that we have a higher risk of transmitting this?
Yeah, no, at this point, those things are safe. Just making sure that you are practicing that 6 feet apart from another person. But those are things that are definitely going to be good for your mental health and your overall health, because you're going to be making sure that you're exercising, but you're also, for your sanity, getting outside and not feeling cooped up. I think that's also very helpful as well. So great suggestions, and it's definitely something that I'm telling patients to do as well now.
Stephen, let's go back to the media literacy piece of this here. Can you give us just some really quick do's and don'ts when we are accessing the media? You already gave a great recommendation at the beginning of the show, but are there any other things we really should be looking at here?
So one of the key things when we think about psychologically healthy media consumption is to stay close to the facts. Many times people will just rely on what's easily available from friends on social media or other individuals who might have very loud voices but not necessarily be referencing the most current, up-to-date, and reliable facts that are being collected. And this is one reason that I recommend the CIDRAP site from the University of Minnesota. They have a disease backgrounder that takes a transnational perspective to allow people to have all kinds of information about what the symptoms are, what may be going on in terms of measures to help people stay healthy. And these sorts of sources are usually using more nouns and verbs, staying focused on the facts. One of my go-to methods of figuring out whether a source should be trusted or not is to think about how much noun-verb use is present versus adjectives and adverbs, the things that really try to amp up or really tamp down emotion one way or the other. Yeah. That's one step that I use.
Yeah. Sources itself. I mean, are there certain sources we should be going to? You mentioned one right there. Let's talk about specifically Nevada. The health district, is that kind of our main source right here? The
Southern Nevada Health District is a big source, and one that will be closer to the ground of Nevada specifically than the federal sites or the international sites might be. So for people who are looking for perspective on what's happening right here and what resources might be available right here, they're a great source as well. And they even have an info line for people to call.
Dr. Madison, Stephen says nouns and verbs is what we should be looking at, specifically when we're looking for topics related to the virus. What should we be looking for? What is the kind of the static that we should just be kind of ignoring here?
Yeah, so typically what I look for, if I think that the source is reputable, if I'm trying to source it appropriately, I look to see, is it from a reputable journal? JAMA just published an article looking at the cases and the characteristics of individuals who were impacted in Wuhan, and sort of that's kind of the first case studies that have come out looking at the pandemic from the epicenter standpoint. And so I looked, is it a reputable journal? Is the Centers for Disease Control, is it matching their recommendations as well as the WHO or World Health Organization? And then at the state and local level, I'm looking, at our governor's task force. That was assigned over the weekend. We've got, amazing experts that have been tasked with advising the governor on how to respond best to the crisis, and I think thus far they've been giving him excellent information. And then the Southern Nevada Health District, the info line that was mentioned earlier, it is only from 8 to 5 Monday through Friday, but you can go to the website and there is a lot of information that links you to places like the Centers for Disease Control and Prevention as well as the WHO. So those are great resources.
Great. Stephen, we got about a minute. I want to talk about just the communication aspect of this too. We are one link in communication here. Can you give us some techniques or some recommendations to follow to make sure we're communicating correctly to our inner circle?
The big set of techniques that I recommend come from psychological first aid. And the principles that we can use fall around providing people timely information that is tied as close to the data as possible, and recognizing what the community's needs are. Taking the pulse of the community and seeing what are the questions people are posing on social media? What is it that they are worried about and what are they concerned about? And this is where your coverage on COVID-19 is excellent, to be able to address those concerns that people are having, because that's what is most salient to them right now. That's what is concerning about them. They need to know, how will I pay my bills? How is it that I can stay close to people when I'm not allowed to touch most of my friends and be near them? And this kind of coverage is what they need, and so thank you for providing it.
Absolutely. Well, thank you for being here, both of you. We really appreciate it. Thank you.
Thank you so much.
Well, we are here with Mike Bequeen, Managing Director and Partner of Hightower Las Vegas. Thank you so much for being here, Mike. Again.
Thanks for having me.
Yep, absolutely. I want to go back to the first segment, and we started the segment talking about uncertainty, and I think at the top of that list of uncertainty is the uncertainty around the impact this is going to have on our economy. What are you hearing out there? What is some of the concern? How is it impacting the general public here?
Well, right now, with so many unknowns, fear is a natural human impulse. And we're in a community that's clearly going to be one of the most impacted in the United States because of our dependence on tourism and hospitality. But what I think a lot of people haven't taken the time yet or come to realize is that we're going to be looking at a very, very large response, fiscal and financial response from the federal government that's actually going to make a great deal of difference in our community, perhaps more than many other communities around the United States. So when you tend towards fear, think about the next several days while these aid packages are put together and realize that there are things specifically designed for our small business community and for our unemployed workers. And that will make a huge difference in the weeks ahead.
It's hard not to look at the stock market dropping and look at just kind of the widespread closing that we have going on, casinos, schools, you can go right down the line, large events, the NFL draft. These are obviously indicators that could induce a lot of panic. Mm-hmm. You're obviously focusing on the positive. Should we be looking soberly at these things as any type of indicator of what the future might behold here?
Well, I'm always one to be a realist rather than a fearmonger. There are certainly things to be concerned about. Who wouldn't look at the Strip closing and the loss of all those conventions and events as anything other than a cause for significant concern? It absolutely is. But again, realize that this will at one point come to an end and we will come back as a city without question. And probably a good deal of that will be helped along by these federal responses that I'm talking about. So while it's a terrible situation right now, and we will remember these days forever, we will get past this, and Las Vegas does have a bright economic future because the experience that we provide is unique in the world. Southern Nevada's unique selling proposition is that things happen here that don't happen anywhere else, and people will return here for those experiences in the future, and that's a given.
We're talking about just what panic means in the financial sector here. I mean, I've already mentioned these indicators. Is this a sign of panic? And if it is not, what is something we should be looking for that could kind of show that maybe we are kind of leading towards more of a panic cycle here?
Well, clearly we've seen in the stock market a panic indicator when we see people indiscriminately selling good companies just to raise money because they fear that things are going lower. Panic is an irrational act because you fear things will get worse. Remember that during the financial crisis 12 years ago, the stock market from the top to the bottom, the peak to the trough, it fell 50%. So far, we're down about 30% right now. So you have to decide whether or not there's a great deal more to go or not. I think that panic is unfortunately one of those things that we have to work through as a society. It's one of the stages that we go through in this process before we allow ourselves to focus and take a deep breath on the fundamentals, that we will be here as a society, that things like Disneyland will reopen in the future. They're not going to be closed permanently. So panic is a necessary part of the human psyche. You hope to minimize it, but you can't eliminate it. You have to deal with it and recognize it within yourself and take a few minutes to focus on the facts. And the facts are that we will survive as a community, and the federal government's response to our needs will be very significant. And those are two things most people who are panicking haven't yet taken into account.
And since we're focusing kind of on that, we're focusing on the panic and obviously the positive side of it, but let's talk about just if we were to go more into a widespread panic, economically here in Southern Nevada or Nevada itself, what might we be confronting then?
Well, obviously the first thing you're going to be concerned with is very high levels of unemployment, right? We do not yet know just how many people will be reporting unemployed status. We know that many of the large casino companies have said they're going to keep their staffs on, including tip compensation in many cases, which is a remarkably positive thing. But a lot of small businesses may not have that possibility. So in the coming weeks ahead, watching the unemployment rate in Southern Nevada is going to be very, very key. And then how many businesses are able to survive, how many small businesses. This program that Governor Sisolak, by announcing us as a disaster zone, opened up a great deal of funding through the Small Business Administration for a lot of small businesses. It was announced just a few days ago and it's being widely utilized already. People are applying. Many small businesses and many nonprofits are applying. And that money will begin to flow in the next few weeks. And also remember that the federal government is likely within the next 2 weeks to start sending checks directly to Americans. That money will be in our hands within the next few weeks, and that will make a great deal of difference. I think when people see those checks, they're going to take a deep breath and realize that there's another force out there that's trying to help them. So in this next several days before that happens, we may still be confronting a bit of a panic situation, but every day people start to take a look at the reality of where we are and where we can be by year end, and realize that it's not the end of the world. We will get through this.
Mike, looking at maybe the next couple weeks, this critical segment that you've talked about, but even beyond that too, let's talk more about the financial literacy aspect again that we talked about in the previous segment. We're talking about business and financial news here. What are some of the do's and don'ts that we should be kind of following?
Well, one of the funny things that you noticed in social media is a phrase that said, treat your 401k like your face, don't touch it. And that's really very good news. That's very good advice, actually. If you had not touched your 401k during the financial crisis 12 years ago and just let it sit and continued to add to it if at all possible, you did very, very well because the market came back to its highs and then went on to much greater highs over time. And we're still well above those levels that we reached down in 2007 and 2008 and 2009. So don't make dumb decisions under pressure. And if you can at all avoid it, Kip, try not to dip into your retirement savings. Remember, those are very expensive ways to get money. It hurts your long-term financial ability to retire if you dip into your retirement now. Realize we've got moratoriums on foreclosures, and we probably have a lot of other accommodation to people who are struggling to meet obligations. So take advantage of every one of those that you can and leave your 401k and retirement plan for the future.
We have a tendency, I know I definitely do, to look at line graphs here. Stock market, of course, is a very clear one. Infection rates, of course, is another one.
Yes.
You mentioned unemployment rate as well. What data sets are really, really key that we should be looking at here?
So everything, the two things that I focus on the most right now, I do look at the new infection rate. Everybody's got one of their two favorite websites, right, that we all refresh every hour or so. And also the other thing to really focus on is what is the federal government doing here in these next 3 or 4 days to finalize this probably $1 trillion aid package. We know there's $300 billion for small business and perhaps up to $500 billion in checks sent directly to people here in America, and probably $50 billion to stabilize the airlines and other programs. There are going to be a series of programs that the government will agree to and the president will sign in the next week or two that will provide a variety of aid packages. So those are the things to focus on. Bending that curve, staying home, making sure we don't infect more people, and what sort of financial aid programs can your employer and you avail yourselves of here in Southern Nevada.
Personal management, ways to lower the anxiety level. We've already talked about some of those. You've been through several financial crises that we've had here in Southern Nevada.
Yes.
If I'm a client of yours, what advice are you giving me right now?
One of the best things you can spend your money on right now, it's going to sound silly, but is probably Netflix. Turn off the cable news networks. We're all addicted to them, and I'm as much as anybody else. But this is a time to catch up on quality things. This is a time to clear your mind and do some personal mental maintenance. We should try to stay healthy, and if you can exercise in your home, and if you can walk around your neighborhood and maintain social distance, but use this as an opportunity also to do a little bit of mental rebalancing. Focusing on the news and the emergency that is at hand will not make you more effective in dealing with it. It will make you less effective in dealing with it. So one of the most important things we try to give our clients is perspective. The worst stock market decline in the last 100 years or so happened in 2008 and 2009. And guess what? It was a finite event that eventually went away. So will this one, as has every other event like it in the past. Now, I will not for a moment minimize the pain and suffering that many of us will feel as a society until that happens. And that's something that we must focus on. But in terms of greater society and the economic impacts, this will pass, and the more you're able to make clear-headed, calm decisions, the better you're going to be at the end of it.
Well, Mike, thank you so much. Pleasure having you on again.
Thank you.
If you'd like to learn more about anything we've discussed on the show today, please visit our website at vegaspbs.org/Nevada-Week. You can also find us on social media at Nevada Week. Thank you.